If walking causes back or sciatica pain, you've been diagnosed with spinal stenosis, scoliosis, or degeneration, then this one simple walking tweak could easily and immediately 10x your walking distance, but also prove that spinal stenosis or arthritis is actually not the cause of your pain. Hi, my name is Dr. Charlie Johnson, physical therapist, and in this video, you'll watch me evaluate a gentleman named Manny, who has trouble walking for more than a minute before he feels like his legs are gonna catch on fire. And while doctors are busy treating him as his diagnosis, I show him a simple tweak that he makes to his walking that in just a matter of minutes allows him to walk up to 10 times further than he has in a year. So if you're struggling to stand, walk, or be on your feet for any length of time, be sure to follow along and apply the same concept that I'm showing Manny to the next time you go for a walk. Also, be sure to stick around to the end of the video because I'm gonna help you understand exactly why this walking tweak works so darn well for so many people. How far can you walk before you get symptoms?
I would say 100 yards.
100 yards? A football
100
field?
yards. I started to, really feel the heat. It is on the butt,
Yep.
and it travels on the outside of the leg, of
Yep.
the thigh, and it stops around the knee.
And then what do you do when you start to get the pain? Do you look for a seat? Do you look for a bench? Do you bend over? Do you stand up taller? What do you do?
I look for a seat. I run. I usually go to Costco, do some shopping.
Yep.
And first thing that I look for is where I can sit,
Yep.
because it starts to when the pain comes, and I beeline to that place, to that seat. So
What happens when you are, say, pushing a shopping cart or something like that? What happens with that experience?
it's comfortable for me to go with a shopping cart. I look for a shopping cart on the parking lot, not on the front of the store, so I can I can support myself. Yeah.
Okay, is there any way I could watch you walk? Like if you open that door, do you have any ability for me to watch you walk or no?
Let me see. It started to go over here.
Yep, I got it. So after like 30 seconds, maybe a little bit less, it's starting the right cheek. Now what I want you to do is this. I want you to walk even taller for me. Pull your hips underneath like this, as if you're trying to get your hips under. Just a little bit. There you go. Yep. It's like you're pulling your hips underneath your pelvis a little bit. Yep, your shoulders. Yep, you got it. Up tall walking, basically. Okay, now when you do that, are things same, better, worse? Just tell me any answer is okay.
It's getting better.
It's not going to be natural for you. You're going to want to pitch forward because that's what you've been told to do, and that's probably what you've learned to do. Keep it tall if you can, okay?
Yeah.
Picture the hips underneath the shoulders. Yep. Up tall. You got it. Talk to me about what you're feeling. Any answer is okay.
I think it's much comfortable.
Now, at this point in the video, I'm going to recreate the experiment. Manny says he wants to go outdoors, so I'm going to send him outdoors. I'm going to show him how powerful this walking tweak is. I'm going to doubly confirm that it actually works again and is best for him. And we're going to give him a more natural gait by allowing him to walk outside and get him some more practice. We're going to have him walk his usual kind of bent forward way. We're going to have him test the up tall way of walking and time how long he can walk. And we're finally going to explain what's happening so he understands how this newfound way of walking is so valuable and why it makes him feel so much better and how it can inform using exercise or movement as medicine in the future. So not up tall, just the way you normally would, okay? Pretend you never met me.
Okay.
Ready? Go. This is his normal way of walking, slightly pitched forward. Now, if he's not careful and he gets labeled as having spinal stenosis or arthritis in his spine, then what is good for spinal stenosis, the diagnosis? Well, a lot of people say you should be bent forward because that reduces the stress on the joints and on the nerves. But bending forward actually makes him worse.
Can you see me?
Yep, keep going.
Thanks.
So if he tries to treat the diagnosis of spinal stenosis or arthritis, then he will, based off that belief, your beliefs inform your actions, which inform your results. I have spinal stenosis, therefore being upright is bad, and I should be leaning forward when I do things. He will make himself worse. When in actuality, he needs to not treat the diagnosis. He needs to treat his movement-pain relationship. When he walks like this, it makes him worse, but when he walks like this, it makes him feel better. that is contrary to and disproves the diagnosis of spinal stenosis. He may have it, but it's not the cause of his symptoms, because when I push him further into an upright position, he feels better, not worse when he's walking.
See me?
Yep. How you doing?
It's starting to burn.
Okay, you can sit down. That's fine.
Well, what is it?
A minute 30. A minute 30 to a minute 45. That's good, man. Good enough. Good enough. Yep.
All right. I'm going
Go for a walk, but pull your hips underneath you, okay?
I'm all right.
Good. Keep going.
How about now?
Keep going. Keep the hips underneath.
All done.
Good job. Good arm swing. Keep it going. Yep. Up tall.
How's that?
Keep it going, man. Good arm swing. Nice brisk walk. Hips under. Keep it going. Up tall.
How about now?
Keep going, man. Up tall.
And now it started to be uncomfortable.
Okay, got it. Pull your hips up even more. Can you do it?
Yeah.
Can you stay walking?
Now I think the pain
Okay,
started.
take a break. That's fine.
Yeah.
Come sit down.
Now I'm sitting.
Good, good.
I went farther than what I usually do.
You went way far. You almost walked 10 minutes, man.
Yeah, you know, pulling the shoulder up made a difference.
Now, where are the symptoms right now?
It's dissipated.
What do you think of that experiment?
That's an experiment, and it's a lesson that I'm conditioned myself to be hooked, you know, walking with a hook, you know, instead of upright.
Yep.
Yeah.
And upright allows you to walk, I don't know, 8 times further or more. Right? Which is awesome. Which is awesome, by the way. So, what you will be told is that you have arthritis in your spine, probably spinal stenosis, all these things. Okay, so you'll be labeled with these diagnoses. All right. And if you treat the diagnosis, then what will happen is this: your beliefs inform your actions, which inform your results. If your belief is that you have arthritis in your spine, well, then you might be tempted to try to bend forward to get away from it. All right. But actually, what I've proven to you is that the more you do this, the worse it gets. And actually, we need to not treat the diagnosis. We need to treat what I call movement pain relationship, meaning this, regardless of the diagnosis, I'm not treating a picture, I'm treating you as a person. This seems to make him worse when he walks. But as soon as I get him even just a few more inches upright and I pull his hips underneath his shoulders, he's able to walk much, much better and for much longer without symptoms. All right. And so the belief, right, of I have spinal stenosis and arthritis, you definitely do because you're 81. Okay. Everybody would have it at 81, but it does not appear to be cause of symptoms, because when we stand upright, we should actually close down more on the nerves and more on the joints in the spine, which should make it worse. And for you, it actually makes it better when you're walking. Does that make sense?
Yes, makes sense.
And so what you're doing when you're slightly flexed forward, Manny, is you're putting a lot of strain on your lower back muscles to have to hold you up so you don't fall over, right? So if I stand here and I'm like this, my muscles don't have to work that hard because I'm kind of stacked, all right? But if I do this, then these muscles have to turn on and engage, right? The longer they engage, the more they squeeze. Muscles are just, if you've ever eaten a steak, you know there's blood inside of a steak. It's a muscle. Okay. When you squeeze a muscle and you contract it because you are leaning forward, oh, the muscle is getting squeezed because it's having to work. It's not getting as squeezed, meaning it doesn't have to work as hard. But when you lean forward, it has to work hard. It's contracted. You reduce blood supply, oxygen, and nutrients, which causes pain. All right? And so to me, when I stand you more upright, it makes walking more efficient and easier for you, which allows you to walk much further. Okay?
Right.
And so the cool thing about this is now not only do you have a tool to be able to allow yourself to walk further, which means you start to get some of your freedom back. Now, it wasn't perfect. You didn't walk for hours, but it does tell us that you're fixable, at least to a large degree.
Right.
Okay? Because without doing any other specific treatment, I can simply tweak the way that you walk and you move, and I can unlock your ability to walk 8, 9, almost 10 times further.
Correct.
So now, not only do you have a tweak that I want you to be using throughout the day, when you're in the store, when you're noticing, when you're out and about, so you can walk further and have no symptoms, then the longer you have no symptoms or the less you irritate the nervous system or the tissues in the body, which are irritated, could be joints, could be nerves, could be multiple things. Over time, that starts to calm things down. It becomes less sensitive. And then what it tells us is that when it comes to using movement as medicine to fix the problem, you might actually like doing something into the backwards motion because you're telling me already you prefer being here, not here.
Right.
Now, the traditional approach that PT would give you would be this. Tell me if I'm wrong. They'd be having you do a lot of this motion and a lot of this motion. It's not going to work. Because that puts you further into the motion that you don't like.
One should be on a straight path, not on the curve.
For you, at least. Now, this isn't universal per se. I work with lots of people who have these problems. This is all I work with all around the world, right? And so at the end of the day, I'm not saying that it's going to work for everybody, but for you, versus just taking kind of, generic advice, when we test, we prove that that is the position that you prefer. All right. And so I don't know the exact motion. We would have to test to find what would be working for you or what would work for you when you think about movement as medicine, not a sheet of things, but one thing that would be valuable. But also, but it does tell us that at least right now when you're walking, you do prefer this. All right. So there you have it. At the end of the day, it all comes down to testing, not guessing, to find what's going to work best for you. If this helped you out, just leave a comment. If it didn't, if it made no change or it actually made you worse, then obviously we don't want to do this, but just know there are many other walking tweaks you can apply to learn to become pain-free. So be sure to check out my other videos on this topic and let me know your thoughts below in the comments. Thanks.